Hey everyone, Ian Hart here. Welcome to day 3. I'm a breathwork expert trained by Wim Hof, who also wrote the foreword to my best-selling book, Healing Hacks. Today, I want you to understand that learning this breathwork practice can dramatically impact every area of your life because it cleanses and cleans the entire body. One of the biggest values I hold for those that I teach is that I get to empower you to understand how truly powerful the mind is. I provide you with the tools so that you can tap into that without needing me here with you. I spent 11 years of my life researching and experimenting on what true health is. And as one of the most sought after fitness instructors in the US, I was diagnosed with an autoimmune disorder that was destined to cause me a lifetime of pain, discomfort, and misery, or so I was told. I dug in and I researched everything I could find. Over the last 11 years, I've found one thing that is the lowest hanging fruit when it comes to impacting my health. That one thing is breathwork. Today, you'll discover some of the secrets many successful and healthy people are using to transform the mind, body, and spirit. If you follow what I'm about to show you, you'll get increased flexibility and mobility, detoxification of the body and the cells, improved immune system, increased strength, improved cardiovascular system, reduced inflammation, decrease in anxiety and depression. If you don't follow what I'm about to show you, you may have higher stress levels in your life, higher levels of inflammation, feel less connected mentally, spiritually, and emotionally. And that's just the tip of the iceberg. But don't take my word for it, give this a shot. Right now, I'm about to teach you the most basic level of breath work that will give you all the benefits just mentioned. This is the basic Wim Hof Breathing Method. It's very simple. The first thing what I'd like you to do is find a safe and comfortable place. You can do it seated. You can also do it laying down with your knees bent, feet flat on the floor. This actually puts your diaphragm in a perfect position. Your diaphragm is one of the most important muscles that we'll be activating here. It actually massages all the other organs and it helps inflate the lungs. Oxygen is essential to every single cell of your body. So now we're going to take your body to the next level by just doing these basic breathing. So now that you found yourself in a comfortable position, we're going to start by doing 30 to 50 breaths. In through the belly, into the diaphragm. Picture the diaphragm like a balloon, opening up the ribs, into the chest, almost like you're breathing oxygen into the head. So we're going to do 30 to 50 breaths like that. You can do it through your nose or your mouth. Beginners, it's sometimes better to go through the nose. If you're having a hard time through the nose, you can go through the mouth. So you're going to do those 30 to 50 breaths, and then at the end of the 30 to 50 breaths, you're going to take a full deep breath in, and then you're going to exhale all the way out until your lungs are completely empty, and then we're going to hold that breath. A few important things. If you have any background or history of epilepsy, do not do this. It has been known to trigger an epileptic attack. So, stay away from this. If you have any health issues, please, before you do any of this, we're not doctors, so seek a physician. Now, you're going to exhale and hold. You're going to hold that breath for as long as you can without forcing. At some point, your diaphragm may start to trigger and start to move that it's time to take a breath in, right? At that point, you're going to take a full deep breath in. We're going to hold the breath, squeeze a little bit of oxygen, and this is where you get to play with it. You can squeeze the oxygen wherever your body needs it. Now, before we get into the breath work, here is some powerful information that this breath work is going to impact in your life. Arterial sclerosis is the #1 killer. It's the hardening of the arteries. It causes heart disease. It kills the most people worldwide than anything else. What this program will help with is decalcifying the arteries. You have 80,000 miles of arteries, enough to wrap around the world twice. What we're going to be doing is flexing the arteries in and out by holding the breath and then taking breaths in. So oxygen, hyperoxygenating the body is what we're going to be doing with the first 30 to 50 breaths, is a vasoconstrictor, so it constricts the veins. Then when we exhale and hold, that is increasing CO2, which is a vasodilator. It opens up the veins. So we're literally doing strength training for your arterioles and every single cell in the body. This is extremely powerful. Plus, we're doing what's called hypoxic training. In 2019, there was 3 scientists that won the Nobel Prize for their studies in hypoxic training. And what they found is that doing something like this or training up in the mountains, this is similar to what we're doing here, is like training up in the mountains because we're exhaling and holding the breath, and the body becomes more efficient at utilizing oxygen. What we're doing is actually increasing the production of red blood cells in the body. The red blood cells are important because they have hemoglobin. The oxygen attaches to the hemoglobin, and then that gets transported to the rest of the body. Anywhere you have injury, anywhere you have inflammation, the more oxygen transported to that area, the faster you heal, the faster you recover, and CO2 has been shown to increase healing the tissues, healing almost every single mental health issue out there. So low CO2 in the brain is directly connected with almost every single mental health issue, from schizophrenia to depression to anxiety. The list goes on and on. Now what we'll be doing is balancing out the ratio of oxygen and CO2 throughout the entire body. And the impact is profound, as you will see. So we're going to start off getting into the breathing. Make sure you're in a comfortable seated position, laying down, whatever it might be. And we're going to start slowly, connecting the mind with the body. So we're just going to put our hand on our belly, right hand on the belly, and we're going to start breathing into the belly. This is one of the most powerful things you can do because most people are breathing into their chest. So really start to connect your mind with it. If you're laying down, let your hand rise up to the ceiling. If you're seated, let the belly move forward. So we're going to take that breath in, into the belly, see as the belly comes out, and then exhale and let it go in. Now direct the flow into the belly. Now we're going to go into the belly, into the diaphragm. Exhale. Now into the belly, into the diaphragm, into the chest. Exhale. You might see that your spine starts to move. This is a good thing. So into the belly, into the diaphragm, into the chest, almost breathing into your head like a channel, like a wave is going up through the body, and let it go. The more relaxed and the more flow you have with the breath, the more oxygen you'll get into the body. So here we go. Let's do 30 to 50 breaths. I'll be going with you and guiding you through it. Remember, at the last 30 to 50, roughly around there, I'm going to tell you to inhale fully, exhale, and then you hold. Empty the lungs and hold. And then just sit there and enjoy the moment. Try to relax the body. I'll guide you and tell you when to breathe. Then you can continue and do it on your own. Are you ready? Let's get started. 1. You can count on your own, or you can just go with the flow. Fully in, let it go. Fully in, let it go. Keep breathing as I talk. As you notice, I'm breathing in through the mouth. I'm getting a little bit more oxygen into the body as I breathe. Fully in, let it go. We're going to pick up the pace. Let it go. Fully in, let it go. Fully in, halfway out, let it go. Follow my rhythm. A little faster. Fully in. Few more. Fully in. Let it go all the way out. Hold. Relax the body. You might feel some dizziness, some lightheaded, some tingling, some emotions may come up. That's all okay. Let it go. Try to relax. Relax the mind. Relax the body. You may feel tingling all throughout the body. And when you feel ready, if you already need to, you can take a deep breath in. For those that can hold it longer, continue. And now we're all going to take a full deep breath in. Hold that breath. If you need to, you can squeeze a little oxygen to the head, to the rest of the body, like a tube of toothpaste squeezing up. Very light and gentle if it's your first time. And then exhale. All right, that's round one. Now you might feel some tingling, you might feel extreme relaxation. There's many different feelings. It all depends on where you are on your path and on your journey. We're going to go right into round two. Are you ready? Let's go. Listen to my breath. Get into the rhythm. Fully in. Let it go. A little faster, let's go. Fully in. Let it go. Fully in. Let it go. Exhale all the way out. Empty the lungs. And hold. Relax and enjoy the moment. Go inside the body. Start to feel inside your body. You can start to think about areas. You might start feeling specific areas in the body. A past injury. You may feel emotions start to rise up. This helps push oxygen into areas that you need it. And this could be trapped in your nervous system and be released. Okay, when you're ready, if you feel like you need it, take that breath in. For others, you can hold a little bit longer. You don't have to follow exactly my rhythm. You can hold your breath a little longer if you feel like you need to, and then go into the other rounds. You can do this on your own. For those that are ready, let's take a full deep breath in. Hold it, squeeze. You can squeeze to the head, to the lower back, to the hips, wherever you need it. Hold it, and let it go. And start to breathe normal. And then we're going to get into the third round, the last and final round. Ready? Here we go. Fully in, let it go. Fully in, let it go. Follow my breath, get into the rhythm, and go. Keep the rhythm. Let the chest rise up. Let the spine move. A little faster. Fully in. Let it go. One more full deep breath in. Hold a little bit. Let it go. All the way out, all the way out. Hold. Now we're going deeper and deeper into the mind and into the body, triggering parts of the brain that take people sometimes 5 to 10 years to get to through meditation. So sit back, relax, and enjoy. You'll notice on the third round, you're able to hold your breath longer, feel it go deeper and deeper into the body. Relax. Completely relax as you go deeper and deeper. When you're ready, you can take that full deep breath in or hold it longer if you feel like you need to. Ready? Go ahead and take that deep breath in. Hold it. Squeeze. Keep holding and let it go. Beautiful. We just went through 3 basic rounds of the Wim Hof Method. You may feel completely relaxed. Enjoy this moment. Enjoy this time. Go into a meditation if you feel like you need it. Or, for those that want to go deeper and further, feel free to. Right now, the magic is happening to the body. You have more oxygen flowing to the cells. And actually, what most people don't realize is happening, as you exhale and hold, your brain is stimulating adrenaline. You now have adrenaline in your body higher than if you were going to go bungee jumping for the first time. So this will give you a sense of euphoria and a feeling of peace and joy without having to go through the fear of something exhilarating like jumping out of an airplane or bungee jumping. So completely relax the body. Some of you may fall asleep. This is balancing out the sympathetic and parasympathetic nervous system. The first 3 days of the 7-day reset has been all about clarity, emotional intelligence, and now breath work. The next 4 days are all about building a new you, starting with how you fuel your body. Tomorrow, day 4, is all about food. Chef Pedro and Ayurveda master Jessica Cruz will teach you an introduction to Ayurveda and its 6 flavors. Thanks for joining me today.